Welcome to WellNow's Ask Me Anything for our fellowship program that's going to be restarting in 2025. We're just gathered here today to ask a couple of our frequently asked questions, go through all of those for any information that could just be easy to have before you apply or to know while you're going through the interview process. So we have a couple people from the team. I'll go ahead and let everybody introduce themselves. My name is Mary Emily. I am a recruiter on the team. I will be probably your first point of contact that you will talk to throughout the process. And then I will hand it over to Liz.
Hi, my name is Liz Benasson-Messon. I'm our Assistant Fellowship Director, and then also one of our Regional Education Directors here at WellNow. I've been here for a little over 9 years, and really enjoy my time in the fellowship. It's just a lot of fun to see all the different classes go through and grow. And it's been just an absolute pleasure to be a part of. And I will kick it over to my colleague, Brooke, to introduce herself next.
Hello, everyone. My name is Brooke Scruggs. I am a physician assistant, and I have been with WellNow a little over 4 years. I am a regional clinical director and really enjoy working with the fellows. It's definitely probably my favorite part of the job. Amanda?
Sure. Thank you. My name is Amanda Smith. I am a physician assistant. I've been with WellNow for approximately just over 6 years now. I am a regional clinical director in Eastern New York. I absolutely love the fellowship as well. I would say it's a favorite part of my role as well. Martin?
Last but certainly not least, I'm Martin Christensen. I'm a nurse practitioner, and I am the medical director of documentation and utilization here at WellNow. I've been with WellNow for, we're going to call it 4 years, and been involved with the fellowship for the most of that time. I'll continue to mirror what everyone else has said. I think the fellowship's really kind of the most fun part of all of what we get to do, engage new providers, watch them grow, and really just be kind of the lifeblood of our business as we, grow our clinics and of course, need new providers to staff them.
Absolutely. Awesome. Well, remember these faces and these names because you're going to work with them pretty often. So I will say, if you've been interested in the fellowship program for maybe a couple of years, you've seen some of our Ask Me Anythings, I would just listen to the entire recording because it is definitely changed since then. And so we'll go ahead and kind of kick it off into some questions. So Martin, you started last. We'll go ahead and start with you first this time. How long is the fellowship program?
Excellent question. So it's 9 months long, and it's the fastest 9 months you'll ever have in your whole life. It goes really quick, but it does have kind of a step-based approach to it. So, it's not overly overwhelming. It's a little overwhelming at times, but it's 9 months. You get a lot of good experience and a diverse number of our clinics, as well as with different providers that you can use that opportunity to glean from their experience, which are obviously varied in our clinics. And again, we see just a lot of growth in that 9 months time.
For sure. And Martin, you mentioned a couple of our clinics. Which locations are we having a fellowship in 2025?
Yeah, so we are continuing to have our fellowship in New York, Illinois, Michigan, and Indiana sites.
And something that has changed this year is we are having training sites. Amanda, do you want to kind of dive into that a little bit?
Sure. Not every one of our sites will be utilized as a training center for the fellows. We do select certain sites wisely, sites that are going to give a more rounded education, sites that maybe see more of those procedures that the fellows are always looking to get under their belt. So we do have designated sites that we use, and all fellows will be working within those sites specifically. You might bounce from clinic to clinic, but they will all be those designated training sites.
Beautiful. Thank you. And then so the interview process, that's always a very big question. So the interview process will start off, you are going to be talking to a recruiter like myself. I have a couple different ones. And so you'll kind of do a phone screen with us. We'll walk through the entire program with you, what it looks like. And then we'll also walk through next steps with you, which is going to be an interview with the clinical side of the team. We call them regional clinical directors is usually who you would meet with next. And they're going to ask you the medical based questions. You'll get asked a couple operational questions as well, things along those lines. And then when should I apply? We are always accepting applications. So always feel free to apply. Always feel free to reach out to a recruiter and start a relationship to just get a little bit more information about it. We never mind speaking early about it. However, we do recommend starting about 2 months early because the classes do fill up very, very quickly. And that way it gives you a little bit of time to get through the program and make sure that you have everything aligned before your start date. And then will I acquire any certifications as a result of being a fellow? Brooke, I'll pass this one to you.
Yes, you will acquire some certifications to become a fellow. All fellows will be DOT certified, so that's Department of Transportation. That certifies our truck drivers, things of that nature. All New York State providers will be required to get workers' comp certified to allow you to do those workers' comp examination. And then on completion, successful completion of the fellowship, you will receive a certification from an accredited urgent care fellowship program.
Amazing, beautiful. And then Amanda, when does the program start?
So in 2025, we have 3 different classes that are planned. We have one for mid-January, and then we have one in March and March 31st, and then August, which is typically going to be our largest class. So 3 different possibilities for these folks.
So exciting. All right. And then Liz, will I be working with multiple providers or are you assigned to a specific person to follow during the program?
Yeah, that's a great question. We get this question a lot. And just like Martin touched on a little bit too, it's actually very intentional that you're going to work with multiple providers and at multiple locations. And there is reason why we do that. You know, when it comes to providers, even the 4 of us providers here on this call, like we all have different passions and we have different strengths. So just being human, we're all going to be naturally inclined to really, dive into what we're most passionate about. So if you only worked with me or you only worked with Brooke, you're probably only going to get what we're really most passionate about. So by working with different providers, you really get a more well-rounded kind of education. And then when it comes to the location, just like Amanda said, that variety we're able to give you because different sites just kind of have different flavors you see as you get into them. But then additionally too, we also want to use it to make sure that our volumes are different for different locations. So we can put you at a site that is most appropriate for where you're at. Because just like Martin said with that stepwise, piece, you're really not going to be at the same place 2 months in that you are 6 months in. So by moving to different locations, we can put you at the place that's most appropriate.
Beautiful. And then would I have to sign a non-compete? I do get this question a lot as well. So Brooke, I'll have you answer that one.
A very good question. No, WellNow does not have a non-compete for fellowship or core provider contracts.
Beautiful, nice and easy. How much is the salary? This is definitely the #1 asked question. The salary is going to change based on the state that you're in and the locations that you are within that state. So what we'll have every recruiter do is they will go through the salary that you're going to make right in the first round interview. So that way you know right off the bat. And then you're also going to be told what you would make post-graduation as well. So they'll be super, super transparent with you. They range just from location to location. So I think that's probably just the best way to describe it right now. And then you are paid on a bi-weekly basis. So you know, hey, I'm going to get the same consistent pay bi-weekly as well. And then is there a lot of opportunity for hands-on learning, such as your own procedures, suturing, splinting, incision, and drainage? Amanda, I'll have you answer that one.
Sure. Yes, there's lots of hands-on training for the fellowship, especially with these procedures. And it actually starts right away in the beginning of orientation, where we focus on giving a brief rundown and an opportunity to practice with your different suturing styles, as well as the different splinting techniques, I&D procedures, and lots more at the beginning of orientation. And then, of course, during your clinic shifts, the fellows are usually wanting to get as many procedures in as possible. So we really focus on those in the clinic as well.
Beautiful. And then my favorite question, Brooke, I'll give this one to you. What is the culture like at WellNow?
So at WellNow, you're going to hear a lot about our PULSE values. We define our culture with our PULSE values. P standing for patient experience, U standing for United Teams, L standing for leadership, S for service, and E for ethics. You know, it's really important because these ideals shape how we treat each patient who comes through our doors, as well as our colleagues, all the way to leadership and organizational decisions. We are an innovative organization that is always looking to be on the forefront of medicine. Our goal is to serve our communities by providing accessible, high quality, and affordable evidence-based care. So you're going to hear a lot about pulse values.
Beautiful. I think something Brooke did forget to mention is we're all funny and goofy as well. So we like to have fun.
Mostly
So
Martin.
if you like to have
That's
fun, come
Mostly
in.
Martin.
Yeah,
the goofy one.
especially Martin. He's got the best dad jokes you'll ever hear. So, and then Liz, what is the schedule like?
Yeah, that's a great question because this is something that will be a slight change from previously that we really think is going to help as well. So we'll talk a little more later about what that means. But Martin mentioned earlier about kind of that stepwise fashion that we take through the program. So we refer to those as phases. So we go from phase 1 all the way up to phase 4 prior to graduation. So our phase 1s, 2s, and then early phase 3 are actually going to be on 10-hour shifts as to start off the program this year. We're actually not going to have our fellows on weekends. We have the most patients and the most support during that week versus the weekends. Of course, people are rotating off just as you will in the future. So we're going to have our fellows work Mondays, Tuesdays, Thursdays, and Fridays in the clinic for 10-hour shifts in that early part of the program. Wednesdays, we have didactic. So we have that in the morning, and then the rest of the day is just theirs. But yeah, so they'll focus to that week. And then late phase 3, as they transition to phase 4, they will join our weekend rotation, but then they'll be switching to 12s as well. And as they switch to those 12-hour shifts, they'll be joining that rotation and requests off and rotating weekends with similar to the core providers, which will ease the transition as you eventually move on to core as well.
Amazing. Thank you.
Mhm.
And so, Martin, do you have to have appropriate state license to apply, or can you obtain one after acceptance to the fellowship program?
So kind of like Emily was saying, certainly engaging a recruiter sooner rather than later is perfectly reasonable. So if you're in that time frame where you've just completed your training and you're yet to be licensed, it's perfectly reasonable for us to start those conversations and maybe even interview. But you do have to have your state license to be able to accept the position or for us to make an offer.
Beautiful. And they take their sweet time getting you your license. So as soon as you can apply for it, put in for it. That's what we always say. So, Amanda, I'm going to give you a super loaded question here. Is there CME offered for fellowship providers? And what does WellNow cover for fellowship hires?
Oh, Emily, this is more than a loaded question here. So I feel like I could speak on this for a solid 40 minutes. So I'll try to summarize it and make it brief. The short of it is WellNow offers for the fellows over 200 hours of CME in approximately 1 year's time. It comes from multiple different areas. We also purchase a textbook called Textbook of Urgent Care Medicine for the didactic portion of the fellowship. It's an incredible resource. It's very urgent care focused. And so it runs through all the systems and the viewpoint from the urgent care provider. Fellows also receive memberships to many online education platforms that we utilize. There's one that we refer to as CCUCM, which is a tongue twister. It's core content of urgent care medicine. Lots of different trainings that we utilize on there. There's also something called Med Mastery that we utilize. It has a lot of different trainings and quizzes for ECG training and that sort of thing. We also pay for an up-to-date membership for all of our providers, not just the fellows, so that to be sure that we're constantly using evidence-based medicine. We also have something called UC Wrap, which hopefully some of you all have been using that as a student. I know I did when I was a student. It's like a podcast. You can listen to that while you're driving and so forth. And then I also just wanted to throw out there that we do supply a laptop for use during the fellowship program. So that way we're assured that you're able to get to this content and do your studying. That is so important to your success. And then we do also cover the cost of your state licensure, your DEA, as well as your DOT certification. And one more plug out there, we also cover for something called Easy DOT, which is another online platform that really helps you approach your DOTs with confidence. And Liz is smirking at me because we're the Ahmed gurus and really enjoying anything and all things Ahmed. So
Beautiful.
And it might be
Wow,
worth
good job.
noting, sorry, Emily, that like some of those things do continue as a core, but the fellows do have access to some extra stuff that the cores don't, just to enhance the program. But things like up to date, that does continue. You see wrap, our core providers do too. So we don't just cut you off all that stuff once you graduate, but you do, get some additional resources as a fellow up front.
Absolutely. Super helpful. Thanks, Liz. And then can I work somewhere else during the fellowship program? Brooke, I'll let you answer this one.
So you would not have the ability to do another job due to the time commitment and the need to study and learn. We find that fellows are the most successful when they are focused and engaged in their training. So therefore, we do not approve outside positions during the program. Just makes it a little difficult. And you kind of need to be devoting that time and energy to the fellowship.
Absolutely. Great. Thank you. All right. I will go ahead and do the next one. What will I learn as a fellow provider at WellNow, and why should I do a fellowship? Wow, another loaded question. Liz, I'll go ahead and pass that one over to you.
That is a loaded question. It's a loaded question just because it's a long answer, but like Amanda said, I'll try to keep it brief. Our fellows learn so much. I think the things I always want to highlight to people is, most of our fellows are just leaving school. We're not underappreciating your education. In fact, a good, solid education coming in is really necessary to be successful in our fellowship. So we are not replacing the education you had. Instead, our goal is to consolidate all that information that you just learned and more. None of us captured everything we learned in school the first time we read it either. But then additionally, none of us tend to learn urgent care specific in school. So part of it will be taking the education and how directing that towards urgent care, occupational medicine, as Amanda mentioned, but then also really honing, critical thinking skills. Critical thinking is something that we might learn in school, but we talk about it a lot in the program, that how do we, really teach you critical thinking skills rather than just knowing how to answer one clinical vignette or knowing how to handle one patient, that you feel comfortable, that you have sufficient critical thinking to kind of reasonably think through any patient would be our goal towards the end. Doesn't mean you're going to know everything and always know, but that you can feel like you've come to a medically reasonable decision and be comfortable with that. And then another big piece of our program is efficiency. I've never known anyone that learned efficiency in school. In school, we're learning medicine, right? Whereas no matter what area of medicine you land in, efficiency actually ends up being a part of that. It's just not something that's always really talked about. So we actually see that as part of our job too. How can we teach you to be an efficient provider without sacrificing high quality medical care and even customer service? So again, your good education is absolutely going to be what's needed, but then our program, all of us were probably thrown in. Did any of us have more than a week of orientation when we came out of school? Probably not. I was promised more, but I don't think any of us probably had more than a week, whereas we really just want to give you kind of more of a runway versus a step to really be able to take off in your career over that 9 months. And I know we've had prior fellows really say that too, that maybe they could have gotten there eventually, but they felt like the program really jumpstart them and got them a lot faster to what would have taken them years to get to, especially from a comfort standpoint. So yeah.
Yeah, absolutely. I've even had fellows who have been in urgent care or emergency medicine and then came back and did our fellowship because they felt like they needed a little bit more help to kind of get through it too. So great job there, Liz. All right. Are we eligible for benefits, health insurance as part of the program? Absolutely. So our fellows are full-time employees. So you get a full benefit package, medical, vision, dental, 401k that you can start stashing into. And then everything starts the first of the 30 days following your start date. So it's a tongue twister, but it's pretty easy to kind of follow. So we'll use the March 31st date as an example. If you started March 31st, your benefits would kick in May 1st. So it gives 30 days for you to kind of make your selection, and then whatever the next first of the month is, that's kind of when your benefits kick in. But absolutely your full benefits package, and you even get PTO as well that you can use throughout the fellowship program. Are there exams? Amanda, do you want to go ahead and answer this one?
Sure, absolutely. Yes, there are exams. There are interphase exams. So these are focused on information that you should be prepared for. Your homework and your didactic time will have you well prepared for these exams. And it's just to ensure and give you the confidence that you're ready for that next step or that next phase throughout the fellowship. So yes, we do have interphase exams for each phase.
Beautiful. And then during the 9-month fellowship, are you able to take any days or time off? I kind of already stole your thunder on this one, Liz, but I'll go ahead and pass it over to you.
Yeah, no, I still think it's a great question. And yeah, so just like Emily said, yes, of course, we understand, people have appointments and things that they need to do with their families, with friends. So, yes, you can request days off. And then just like Emily said too, sometimes it's not as simple as just wanting to work a different day, that we need time off. I hope you have some cool vacations planned. I want to go on vacation, too. So, you have PTO as well, so that you can take time off throughout the program. Mhm.
Beautiful. Okay. How long until I hear I am selected for the program? So typically we have all offers out at least a month before your start date. So if you are applying for maybe a later class, it might take a little bit longer for you to hear, for you to go through the interview process. But you will know at least a month prior to starting that you are receiving an offer. I can speak on all of the recruiters' behalf when I say we will drive you crazy. We will constantly keep in contact with you and talk to you throughout the entire interview process and kind of let you know what we know. And so you'll always kind of at least be up to date on that side as well. And then are providers expected to see a certain amount of patients per shift? And would this apply during the fellowship? Martin, I haven't heard you talk for a while, so I'll go ahead and pass it over to you.
I know, I need to talk. My goodness. So yes, yes and no. So certainly there's goals that kind of go along the phase approach, where we really are looking for increased efficiency, increased throughput, ability to maintain that quality level of care while seeing more patients, and there's goals for each phase related to that.
Beautiful. How long does credentialing take for either a new or seasoned provider? Amanda, I'll go ahead and pass that over to you.
Sure. So depending on the state, this could look a little bit different. So I will say that in order, as you apply, you do need to acquire their license for the state of which they're going to be completing the program. Once you have that license, the credentialing can take up to 60 to 90 days. So the sooner we start that process and troubleshoot any issues that are going on, the better. In addition to that, you would also need to obtain your DEA and within that time period as well. And then specifically for New York applicants, you'll need the New York State Medicaid. That process can take up to 6 months in some cases. The good news is that as long as your other credentialing items are complete, that we can often go ahead and start you in that program at that time until your New York State Medicaid comes in completely. And then specifically for Illinois and Indiana applicants, as soon as your license is complete, you'll need to be applied for the controlled substance license so that you can get your DEA in a timely manner. But we have Emily and other members that are helping throughout this process and troubleshooting in order to make sure that this is all getting done in a timely manner, as timely as possible.
Absolutely. Okay, beautiful. How does WellNow value diversity? What steps have you taken to ensure WellNow is diverse? Brooke, I'll have you answer this one.
So this is my favorite question. So at WellNow, we are beyond committed to fostering a safe, inclusive, and open-hearted environment for our United team and our patients. And a DEI will allow us to do just that. After all, embracing diversity, inclusion means embracing our own authenticity and the authenticity of others. This could mean increasing access to care, providing quality service for our patients, And it also means improving the employee and the patient experience so that everyone walks through our front door, whether it's staff or patients, feel like they belong. Expanding fellowship into cities that have diverse populations of candidates, reaching out to schools that have diverse populations. And even our group of RCDs, the regional clinical directors, are a diverse group with different religions, sexual orientations, races, and genders. So I think we very much value diversity.
Yeah, absolutely. Awesome. And then Liz, what is the location agreement?
Yeah. So the location agreement essentially says that you would be open to being hired or relocating even outside the area that you complete your program in, because that may be where the core positions are available when done. So we may have, if Buffalo is where you do your fellowship, it's possible that we would not have enough open core positions in Buffalo upon completion of the program, but we do always have open positions. So if we had one, for example, in Rochester, we may ask that you go there. It doesn't mean that you are then required to work there for, X years or anything like that. But that is something that we want to ensure that people are at least open to.
Okay, awesome. And Liz, you kind of alluded to the next question, so I'll have you answer that one as well. Of what happens once they graduate the program? Are they going to be offered a full-time position, or how does that work?
Yeah, that's a good question. And you're right. It definitely does kind of relate to the last one. So, yeah, the vast majority of our fellows do stay on with us. So they receive a core provider offer during the program. We really are we've often done it in late phase 3 to 4, but we're actually going to be moving that with respect to what I just mentioned. So we're going to be moving that more into early to mid phase 3. And actually, what we're going to be, another change we're going to be having our fellows do is that our fellows are actually going to rank the top sites that they want based off our open requisitions. That means open positions at that time. And so our fellows, and so then, say the 5 of us all rank the same, top site first. Can't say I've ever seen that happen, but, hypothetically, how do we then decide? So, just like Brooke was speaking about too, fairness and equality is very big to us, and equity is big to us too. So the fellows are going to actually be ranked based off their KPIs and performance. And so then the highest ranked person will have their first choice first. So if all the sites are filled in that region, then the next thing would be to offer something in a adjacent area. But we will go through them like that first. So we'll start with them, ranking them, and then we'll have the rank based off that KPI and performance and go from there. And that will be continued conversation and transparency at that time too during the program.
Beautiful. Yeah, I was going to just say that exact same thing. Your RCD will talk to you the entire time. A recruiter will reach out to you in between to kind of walk you through the offer, everything like that as well. So you'll always be communicated with and have a knowledge of what's going to be presented by the end of the program for you. Here's a really fun question. Is there a sign-on bonus, Martin?
Our fellows do get a $10,000 sign-on bonus. The way it works is you get half of it or 5,000 of it upon starting, and then the second $5,000 payment is paid upon graduation and becoming a core provider. There is a payback clause that requires you to stay on at least a year after graduation. I don't think I got any of that wrong. Is that accurate?
Nope, that's right.
Okay.
And most of
All
our
right.
former fellows stay on longer than that, but still, we are trying to be
Exactly.
reasonable with that. Mhm.
Perfect. And then will I have to work holidays or weekends? What perfect timing since we're so close to the holidays right now. Liz, I'll have you answer that one.
Yeah, I mean, first I'll call, urgent care, have all of us worked weekends and holidays? Of course, absolutely. But we've talked about Brooke is like, absolutely. We've talked about how rigorous this program is, right? So especially in our phase 1s and 2s, actually really won't be working many, if any, weekends or holidays. Especially early on in the program, we don't see the point on putting you on a holiday just to put you on a holiday. All of us in healthcare will undoubtedly work holidays at some point, but we don't want to do it just to do it. So phase 1 and 2, again, unlikely to have any at all. And then phase 3 and 4, because they're starting to join more of that rotation that you'll see when you graduate as well. Yes, you'll see them transition to weekends. And again, there's a weekend rotating schedule. So, you can still plan your life and plan activities. And then same for holidays. Those are shared. We don't do a seniority based. Those are shared so that it's equitable too with that.
Beautiful.
So early on, nope. Later on, sure. We join the regular rotation with others.
Absolutely. Okay. And then Brooke, I'll give you this one. It's my absolute favorite question about WellNow. So is there room for advancement here?
This question makes my soul shine. I love it. Yes, WellNow looks to promote from within. There are many nurse practitioners and physician assistants in various aspects of leadership at WellNow, from clinical leadership to operations to finance. I think probably everyone on this call started out as a core provider and worked our way into different positions. So yes, we definitely promote from within, and we definitely have very many avenues for growth and leadership.
Totally.
I always tell candidates, I have yet to anyone take me up on this. I challenge you to find another organization with more MPs or PAs in leadership versus just physicians. Of course, we have some amazing physicians, including our CMO, Dr. Birnbaum, who are in leadership too. But I haven't had anyone come back yet with another organization with more MPs or PAs. So challenge extended.
Perfect. Awesome. Well, I think those are pretty much all of the frequently asked questions. Like we said, we just kind of put these together as the questions that we consistently get. So if you have any more questions, feel free to talk to your recruiter in that area whenever they reach out, or any other questions that you kind of have, feel free. We're really an open book. We're extremely proud of the fellowship program. It's our bread and butter. And so any questions that you have about it, we are here to answer them for you.
Thank you.
Bye.
Thanks, everyone. Bye. Look forward to
Bye.
seeing you.